Very good morning. I shall be talking about botulinum toxin. I'll be giving you a brief introduction and the reconstitution techniques. The wonder drug botulinum toxin identified a century ago when we discovered the anaerobic organism Clostridium botulinum. But now it is recognized and it has made a huge, tremendous impact in a variety of clinical diseases in the treatment. It acts specifically by targeting the release of acetylcholine. The toxin to drug conversion is by several steps. It's by isolation, purification and stabilization. Now, why is botulinum toxin an efficient therapeutic agent? It is because it is highly potent, it has got high neurospecificity, it has got limited diffusion when it is injected locally, and it is also has got reversibility of action over the period of time. The Clostridium botulinum, we got several strains. From which we have 7 serotypes, A to G, of which C and D do not affect human beings, but A, B, E, F and G are, has got effect over human beings and domestic animals, of which we have A and B available as drugs. All these drugs have got different molecular targets, but the end point is the same, that is a blockage of the cholinergic nerve terminals. So the clinical uses are many. When it is injected, if it blocks the motor nerve terminals, that is where we have in the treatment of focal dystonias and segmental dystonias, spastic conditions and also in cosmesis. When it blocks the autonomic endings of the glands, where it is treated in hyperlacrimation, hyperhidrosis and hypersalivation, it is also has got some role in the pain indication because it interferes with the transmitters of pain perception, transmission and processing. So the structure basically is the same, like it has got a light chain and a heavy chain. Light chain is the catalytic domain, heavy chain has got 2 domains, the translocation domain and the binding domains. So the mechanism of action, it has got 3 steps. One is the irreversible binding to the presynaptic terminal. The second is the internalization into the axon. The third most important step is the cleavage of the snare proteins. So the action, here is the animated version. When it is injected, it goes into the nerve terminal, gets internalized after binding. So this is it forms an endocytic vesicle, gets translocated and extrudes out of the vesicle, and the disulfide bond reduction happens and the active L chains cleaves the snare proteins. So remember, the effect does not take place immediately. It takes about 3 to 4 days for the effect to come, and also the effect does not last over, it decreases over the period of time because of the axonal sprouting, and impaired transmission gets restored. The products available, known financial interest here, we have Botox, Xeomin and Dysport. The difference is in the amount of protein and also in the amount of albumin added to the product. So basically the unit of botulinum toxin corresponds to the calculated median intraperitoneal lethal dose in mice, and we need to remember the units of one product does not correspond, or it cannot be converted into units of the other product. For example, in Botox and Dysport, based on the available studies and clinical trials and also in the conferences, the ratio is close to 1:2.5 or 1:3. And there are also other basic differences between Botox and Dysport, because Dysport has got fewer proteins and there is quicker absorption by the body. That means it takes effect sooner than Botox. It takes about 1 to 2 days compared to 3 to 5 days in case of Botox. It remains active in the body for slightly longer time. That means we don't have to treat the patient frequently. And also the depth of injection. The Dysport injections are to be administered a little deeper. It tends to spread deeper and it spreads more easily throughout the treated area. There is a downside here because in case of inexperienced hands, there is an increased chance of complications like drooping of eyelids or brows when it is injected in the forehead or crow's feet. So how do we handle this toxin? The medicine is available as lyophilized powder. It has to be kept in refrigeration. Basically the steps are simple. There is a strong vacuum in the vial. We use preservative-free sodium chloride 0.9% as diluent. The introduction of the saline has to be very slow and the vial should not be shaken. And foaming has to be avoided because it denatures the protein. How much diluent to add depends upon the product that we are going to use and the concentration that we require. For example, if you require 5 units in 0.1 ml. If we mix 2 ml to 100 units of Botox, that is what we get. So here's a short video on Botox mixing. We use 0.9% sodium chloride solution, and this has been taken whatever concentration that we require, mixed to the Botox vial. As I mentioned, there is a strong vacuum. We don't have to inject, it pulls on its own, and the required drug can be withdrawn and used. So the manufacturer recommendation is about that we need to use the drug within 24 hours of reconstitution. Originally it was thought to decrease the potency when we store it for a longer time, but there is a controversy here. Like, there are studies which says that even we can store this reconstituted drug for about 6 weeks or so. So take home points would be, it is a pretty safe drug, effects are reversible, it has to be reconstituted with care, and units of one product do not correlate with the other. It has to be refrigerated till we use it. Thank you very much.